this video and the subsequent video I'm going to talk about ovarian cancer. Okay, ovarian cancer. First of all, ovarian cancer is uncommon cancer with 3%. Okay, it may come at any age, but mostly between 40s and 60s. Okay, it is a menopause disease, especially the epithelial type. I'm going to talk about epithelial type in the subsequent video. Okay, ovarian cancer has different types, okay, and each one is a totally different disease with a totally different shape and way of treatment. Okay, so let's start with the risk factors of ovarian cancer. What are the risk factors of ovarian cancer? First of all, obesity. Obesity is a risk factor of ovarian cancer. Family history of other cancers, okay, like brain cancer, like endometrial cancer or ovarian cancer. Okay, so obesity, family history, and any patient with one cancer is more susceptible to have other cancer. Okay, so another cancer is a risk factor for ovarian cancer. Smoking actually is important factor, risk factor of ovarian cancer, especially in mucinous type GI cancer. Okay, mucinous type ovarian cancer. Fertility drugs also is a risk factor of ovarian cancer. So obesity, family history and other cancer, smoking, and fertility drugs. And I can make it easier by saying that the patient with ovarian cancer would be an obese patient that smokes and has a mom that has got ovarian cancer or brain cancer, for example, and she takes fertility drugs, okay, and has, for example, also endometrial cancer. Okay, so what is the presentation of ovarian cancer? Asymptomatic. Most of cases of ovarian cancer comes with no symptoms. Okay, the most important symptoms of ovarian cancer when they are existed is GI symptoms, and especially ascites. Okay, ascites is a very important and very common GI symptom of ovarian cancer. Okay, and from this ascites we take a sample for cytology. Okay, we do paracentesis and take sample for cytology. Okay, bloating also is an important GI symptom of ovarian cancer. Inflammatory bowel syndrome also very important. So asymptomatic is the most common symptom. GI symptoms is the second most common. Ascites, don't forget ascites. And it's very uncommon to have gynecological symptoms. Okay, patient with ovarian cancer rarely comes to clinic with gynecological symptoms and no constitutional symptoms. Okay, weight loss, nausea, vomiting, it rarely happens. If it is there, then you have to think about other things. Okay. What about the protective factors of ovarian cancer? We talked about risk factors: obesity, smoking, family history, other cancer, fertility drugs. What about protective factors? What things can protect us from ovarian cancer? Okay, breastfeeding is a protective factor. Combined oral contraceptive pills is a protective factor, and hysterectomy is also a protective factor. Okay, so breastfeeding, hysterectomy, and combined oral contraceptive pills. Okay, so these are protective factors. After the presentation, asymptomatic GI symptoms, we move to physical examination. What to do in physical examination? The most important thing is that to do abdominal and vaginal examination with speculum by manual examination. Okay, it is unusual to have outside abdominal finding. Okay, if yes, then we have a lymph metastasis. Usually in the abdomen we see an ascites. Okay, we may feel a mass but it is unusual to have outside abdomen finding. Okay, after the abdominal examination, we move to the vaginal examination and bimanual. By manual examination, we can find the lateral masses. Okay, lateral mass. If we find posterior mass, then we have to know that there is a cul-de-sac mates or cul-de-sac seeding, and I want you to take care of a point that when cul-de-sac is smooth, the mass in cul-de-sac is smooth, or in the posterior aspect of the uterus is smooth, then mostly it is a benign condition. Okay, when it is nodular, then it is mostly malignant condition like ovarian cancer. Okay, so this is about a posterior mass. So by bare vaginal examination, bimanual, we can find the lateral mass and sometimes the posterior mass when we have cul-de-sac seeding. Okay, take care that ovarian cancer is spread by seeding to cul-de-sac, for example, by lymphatic, and this is most important type of mets is by lymphatic in ovarian cancer, and it's rarely spread by blood in very late and advanced stages. Okay, so this is about the physical examination. But what about the investigations? What investigations we have to do to diagnose ovarian cancer? First of all, the most important is histopathology, and we can take a biopsy to histopathology by interventional method. You have to have an interventional radiologist to take a sample from the ovary and to do histopathology. Okay, and we can do it with laparotomy maneuver. When interventional method is not working, then we move to laparotomy. Okay, for example, due to a huge ascites. Okay, then genetic studies is rarely done, but the important thing that we have to do, BRCA1 and 2 genes is associated with breast cancer, with endometrial cancer, with colon cancer, and with ovarian cancer. So patient or people with BRCA1 and 2 positive genes has to remove the breast and ovaries and uterus in some cases. Okay, like Angelina Jolie, for example. Okay, she has BRCA1 BRCA2 genes. Okay, then ultrasound is to be done. In ultrasound, we can distinguish simple and complex or malignant cysts. How do we distinct between these two, simple and complex cysts? First of all, simple cyst, we can see simple cyst as a fluid in ultrasound, okay, as a plaque material, but complex cyst is seen as a solid material. We see echogenicity. Okay, simple cyst is unilateral in most of cases. Okay, but a complex cyst is bilateral in most of cases. Okay, there are no papillary projections in simple cyst, but in complex cyst we have papillary projections. We see like papilla on the ultrasound. Okay, the wall of the ovary is very thin in simple cyst. Okay, but in complex cyst it is either normal or thick. Okay, normal blood vessels is seen in simple cyst, but in complex cyst the blood vessel is fragile. Okay, so we can see no resistance in Doppler ultrasound. So again, how to distinguish between simple and complex cyst in ultrasound? Simple cyst is fluidy. We can see a plaque material, unilateral in one side. So okay, it is a fluid, unilateral in one side. There is no papillary projection, with very thin wall and normal blood vessels. But complex cyst is solid. We see echogenous material on ultrasound. It is bilateral in both sides, and it has a papillary projections and a thick wall with a fragile blood vessels. Okay, the last thing to talk about in investigation is the tumor markers. The most famous one is C125. Okay, but this tumor marker actually is not that specific, because we can see it in any condition with irritation to the peritoneum, like endometriosis or adenomyosis. Okay, in both these conditions we can see a tumor marker C125. Okay, so it is not specific, and also in 15% of patients with ovarian cancer has not this tumor marker C125. Okay, so we can depend on CA125 to diagnose ovarian cancer, but it can help us with the following up the case, and to know the chances of recurrency. Okay, to know the chances of recurrency. And also what investigations to do is to do a baseline investigations for everything, to take a pap smear, and so on and so forth. Okay, so the most important is histopathology. After histopathology, ultrasound is done to compare simple and complex genetic studies. Before histopathology we do ultrasound. Okay, in the next video I'm going to talk about the types of ovarian cancer, and I'm going to talk briefly about management of ovarian cancer, chemotherapy, etc. Thank you for listening. See you in the next video.